Here is a bar graph that shows the differences based on the average of those 5 studies that show that we get around double the clinical reattachment versus clindamycin or Doxirobe. So let's describe this a little more succinctly as we approach a clinical case. So say this is a case that you're doing in practice. You're looking at this maxillary canine and you can see that line of marginal gingiva that's really inflamed already. We haven't placed the probe in that area yet. We've got it at the distal margin of that defect. And we're going to just run that by once or twice very gently with the probe at the base of that pocket to see if we get any bleeding upon probing. So HA is a negatively charged compound. The proteins within the extracellular matrix are positively charged. So we get that hydrostatic bonding effect, which in turn allows hyaluronic acid to adhere to the gingival connective tissue, which is where we want it to be. Fortunately, with PerioVive as a hyaluronic acid gel, we don't have the technique sensitivity that we had with Doxirobe. One thing that you'll note when you're doing your subgingival curettage and your root planing, even after you finish that, you're going to get some bleeding. And you might ask yourself, is the bleeding going to interfere with the retention of PerioVive within that tissue? As it turns out, the bleeding actually enhances the retention of hyaluronic acid gel in a periodontal pocket. So looking at it from the placement standpoint, all we do is take that blunt tipped applicator, place it at one end of the defect into where the base of the pocket is, and apply the gel until we see it come up into the area that is adjacent to that gingival margin.